Happy Friday, everybody. Welcome to everyone's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's episode, first off, the risk of having very large breast implants. Do you know what they are? We're going to tell you. Next, hospital-acquired wounds, what you need to know to help a family member maybe avoid them. And then finally, Sarah's going to tell us all about high-protein diets. I can't wait to hear it because I want to do that, and it's coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle, with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for joining us. We really do appreciate it. Please hit that like and subscribe button. It helps us so much. Also, leave us a comment. We want to hear from you. I'm your host, plastic surgeon Dr. Bruce Hermann. With me is the amazing Sarah.
Howdy.
Hi, amazing Sarah. How are
Hi.
you? In the box is the awesome Travis. Hi, awesome Travis.
Hello, how are y'all?
Doing good. It's Friday, man. I love Fridays. I'm here doing a show. It's the end of the week. Love it, love it, love it. You guys have good weeks? Anything exciting happen? Same old stuff?
Same old.
I went to the fair, rode the Ferris wheel.
You did?
I did.
Oh, you know what? I didn't tell you guys, or did I? Did I mention in the last show that I went to the Texas OU game?
Oh,
Yes.
yeah, you did. You said you had a
won?
ticket.
So, oh my God, it was crazy. Oklahoma ended up winning.
Oh.
But
Don't they
it was.
usually?
I don't want to relive it.
I know, I
Haven't
was crushed, but the
haven't
game-
They had a better football team for a while than you
Yeah, but Texas was really, really good this year.
Close.
But
Texas won last year, I think, too, right?
yes.
I think they won last year, if I'm not mistaken.
I'm not sure.
Yeah.
But speaking of the fair, I love the fair. We're actually going to go pretty soon.
Yeah, I need to take Avery, but she doesn't like the Ferris wheel. I took her on the Ferris wheel like at a regular fair, and it scared the crap out of her.
Oh, she would
Honestly,
hate the
it's-
Texas Star. It's like so high.
I know, I've been on that one, but it's more safe. Like it's more like
Yeah, it's like
it seems-
legit.
It seems like less like.
It's not going to like
little.
roll down the road.
Well, the one I took her on, it was like my sister said when she was watching us from below, it was like going like this.
So do you guys like, okay, this is random.
Yeah.
Do you guys like those crazy adrenaline rides or?
No, I'll go on the like roller coasters at Six Flags
Okay,
or something, but
okay.
I will not ride a ride that like one of those weird rides at a fair.
What about the Texas Fair? I mean, it's a little different. That's like a little bit more legit.
No, I won't ride those.
Really?
I don't like rides.
Okay.
I like a roller coaster.
I like a good
something
roller
that has,
coaster
like,
too.
Tracks.
Yeah. I mean,
I'll get on something that's tame, like the ship that goes like back
oh
and
yeah,
forth.
we always do that one.
Yeah, I'll get on that, and then like the thing that spins you around like really fast.
I know that one too. I can't remember the name of it, but I know exactly the one. Yeah, those are fun.
The one at Six Flags?
The one at the fair.
At the fair.
Yeah.
They're right next to each other. They're right. The ship and the other one are right there. Yeah.
Mhm.
Yeah, we hit that. Like my kids love those things, and my kids always drag me on like the crazy ones. Like we'll do the slingshot one where you get in that ball and it
That's
launches
tough.
you up into the air. And,
That's tough.
Or the one like we did the one time where you're on a wire and it pulls you up and then it drops you. They're kind of like they are a little. They're exciting.
Absolutely. Those are like really high adrenaline.
Yeah. My kids they just love them. And
My
so,
dad liked roller coasters,
Mhm.
but none of us really did.
Really? I love roller coasters. So much fun. I used to go to Six Flags when I was a kid. You'd save up and you get like your season pass and then get someone to take you like in the summer.
Yeah.
Absolutely.
So much fun. All right. All right. Well, let's move on to some topics today. So
Yeah.
I don't know if we've ever talked about like really, really large breast implants in the
I remember we've seen, like, you've shown us examples of chicks that had gotten
Had problems?
extremely
Yeah.
big ones.
Okay, well, I want to do a segment on the risks associated with, you like that? I mean, the risks associated with large breast implants. And the reason I'm bringing this up is it was a couple weeks ago now, there was some news articles about a former Miss USA contestant. Her name is Rachel Slauson. She was Miss Utah 2020. I think I got a picture of her. Beautiful young woman here. And so she was in the news talking about her, the title was Miss USA contestant regrets having plastic surgery. I'm like, oh, that's interesting. Why because you shouldn't.
Yeah.
You shouldn't. I mean, if done properly, you shouldn't really regret having plastic surgery. Most people get it and are very pleased. So like, what happened to her that she had this bad experience? And so I read the article, and she was talking about how she decided she wanted to have a breast augmentation. Okay, that's normal. A lot of people do that. And she went in and she asked to be 32D, and so you don't really ask to get like the band size. You really ask to get the cup size, because if you're 32, you're 32. You don't really change that. But she wanted to be a D, and when she came out, they made her a triple D.
Oof.
I know, right? I was like, oh my God, no wonder she had a bad experience. And honestly, that is a huge, huge pet peeve of mine when people go to a plastic surgeon and the plastic surgeon doesn't take the time to figure out what they want, and they come out with something that they don't want. And generally it's something way bigger than they wanted. That happens so many times, and I just don't get it. I mean, I do get it because I've seen plastic surgeons when I was, in training or whatever, that just didn't take time to talk to people. And I feel like the reason that it happens is because, well, two reasons. One of the most common things people will say after getting an augmentation, if they get like a good one, they'll be like, oh, I really love it, and maybe I wish I'd gone a little bit bigger. And so I think some surgeons will, maybe push people to get larger so that they're not unhappy. But I mean, I don't have people that are really unhappy. Because, I tell them that there are downsides to going really big. And then the other reason is sometimes whenever people have a little bit of sag of their breast, a larger implant kind of helps that. A large implant doesn't do the same thing as a lift, but it can kind of, mask it a little bit.
Right.
And so I think that's why sometimes these surgeons will put in these giant implants. But the problem is that, there's risks associated with that. Like, there's problems that can happen. And I see it time and time again in my office where someone will come in, they had a breast augmentation done maybe a few years ago or 5 or 10 years ago, and now they're really unhappy because of either a complication they had from having really large implants, or their body's changed and suddenly their breasts are out of control.
Yeah.
And so when I have patients come in to my office wanting breast augmentation, which is one of my favorite things to do, it's a very artistic surgery, satisfaction rates through the roof, patients generally do great. I spend a ton of time talking to them and going over exactly what they want. And if they say that they want something really huge, then I have a really honest conversation with them about, okay, if you decide to go this route, these are the potential downsides. And a lot of people will, if they want something maybe a little bit too large, will take my advice and say, okay, that makes sense. Maybe I want to reconsider what I want. And some people say, look, I understand what you're telling me. I'm willing to accept the risks and go ahead with this. And if I feel like it's, not insane, I'll do things, bigger than maybe I would recommend.
Yeah.
But I have to make sure that patients understand, and that's where I think a lot of people don't get that experience when they go to doctor's offices and it's more rushed, or maybe they're talking to a nurse or something.
In my experience, whenever I had mine done, like, I remember whenever I was like, it's like maybe a day or two, and I was like, gosh, I hope the swelling goes down. These are
right, and that's super common. I mean, that's a
Yeah.
totally separate issue, because when you have surgery, and I tell all my patients this too. I tell them, I did 4 implants this week. It was really busy. Every patient I'm telling them, like, okay, when you wake up, you're going to be swollen up top, and you're going to look bigger than you're going to be.
Yeah, I
Just
felt
be
like they were like in my face.
Yeah.
I was like,
You're like, please tell me this is
they're like invading my life.
They're invading
yeah.
my perimeter. So risk of large implants. So this is important because there's plenty of people out there that might be considering implants themselves, or they have friends that are considering having them. There are definitely risks of getting really big implants. So one, really big implants are much more prone to get out of position. And what that means is you want the breast implant to be right behind the breast. And you definitely don't want it to fall down or to the side. And the larger implants, because they're big, because they're heavy, they are more prone to get out of position in the first few months before the layer forms around the implant and locks it in place.
Right.
And so that's one of the risks of getting bigger. And when I say large implants, I'm talking, I use on average 250 to 400. I commonly will use maybe 425, 450. I'm talking more like 500 cc and larger. And some of that is depending on the patient, because there are patients that maybe have really, really small breasts and they can take a 450 and it's not that big for them.
Like, I want to know like the maintenance of Dolly Parton's boobs.
Yeah, I want to know how big her implants are.
Yeah,
They have to be huge.
because she has had to have them done again multiple times.
Is she still alive? Yeah, she
Yes.
is. Yeah, I haven't seen her in forever.
She's
banging around? Yeah.
Yeah.
I haven't seen her. Other risks of large implants, they do actually, if you get a really large implant, and especially if your skin's tight, it will actually wear down your breast tissue. You see that commonly when people get big implants and then 10 years down the road, and they're literally just skin and implant, because the weight of that implant actually starts to wither the tissue from the pressure.
Yeah.
That does happen. Along those same lines, incision breakdown is more common when you get a really big implant, just because of the pressure. You know, when I do larger implants, and I do this for every patient, so it's not just these, but you definitely want to make sure that your closures are really good and you're getting a lot of good tissue closed underneath the incision so that there's cushion, so that implant isn't pressing on the underside of the skin. Because I have seen people come from other offices, they get these giant implants and the incision breaks down, and then it becomes like a real problem. Another risk, and this kind of goes along with the malposition, but remember when we talked about the uniboob queen?
Yeah.
Yeah.
I think that was the one that I remember.
Yeah, the uniboob. I forgot her name, but she's on social media. It's called the uniboob queen. And so uniboob is also a risk of having really large implants because it starts to invade the perimeter towards the center, and suddenly you go from 2 separate breasts to like one big uniboob. So yeah, it's not that. I've had to fix. I've never had that happen to my patients, thankfully. But I've fixed a couple of those because I do a lot of revision work, and you can fix it, but it just kind of sucks to do it. And the other thing, as far as the, well, 2 more things. One, when you get these giant implants, they tend to look super fake. Now, some people want that. I literally have people come in my office and they say, I want the porn star boobs, which is just code for like, you know, this big round fake looking breast. And some people like that, but I mean, a lot of people may not want that. They want to be large, but they don't want to have that look, and sometimes they'll get it
Yeah,
because
they want it to be like proportional with their body.
right. And so, you know, sometimes people will get a look that they don't like. But the other thing too, when you go really big with implants, is you can start to have some of the same symptoms that people have when they have large natural breasts. I mean, I still do a lot of breast reduction surgery. It's still pretty popular. In fact, I would say breast reduction patients are some of the happiest patients. But you can have symptoms of what we call macromastia, or very large breasts. And that would be things like neck pain, shoulder pain, back pain, grooving in the bra straps, the breast starting to interfere with like working out or exercising, or even your daily activities, depending on how large they go. And you know, the other reason too, like you should consider not getting super large implants is, and we've talked about this just even in the past few weeks, I know, is as we get older, we tend to gain fat. And where do women gain fat?
Yep.
They gain it in their breasts. And so you commonly will see, and I get this consult every month for sure, maybe even a couple patients that had implants put in when they were, you know, 20, 30, maybe early 40s, and then 20 years go by and they gain some weight, and suddenly their double D breasts are now like Fs.
Yikes.
And they're super unhappy and they want their implants out. And you can do that, and that's fine, but it does mean that you have to have another surgery, versus if you go a little bit more conservative at first, you gain a little bit of weight, and maybe you might be slightly large, but you're not to the point where you're unhappy. So.
Yeah.
But yeah, I'm against like doing, you know, really, really large breast implants. I think a lot of times patients that get them are not getting a great experience with the doctor-patient relationship.
Yeah.
You know, I don't think that maybe they're being informed about the potential downsides. And so, you know, that all goes back to, if you're gonna have plastic surgery, one, find a board-certified surgeon, that's so important, but find a doctor that's gonna take the time to talk to you and like go over all the details and tell you all the ins and outs. Because if you don't, you can end up being unhappy like Miss
I
Utah.
feel like when doctors tell you like, no, you don't need to do that.
Right, you
like,
should
they're
listen.
Not like, yeah,
Yeah, you should listen to that.
yeah. I'm like,
Yeah. I mean, I'll tell people no.
but I think that's a good thing.
No,
I don't think
totally
like
a good
like
thing.
I want to have, you know, double Fs or whatever.
Yeah, and you're like,
and the doctor's
"No."
like, yes, let's do that. Like that
Right.
should be a red flag.
That should be a test. Like, go in
Yeah.
and say something dumb to the doctor and make sure that they correct you.
Yeah,
And if they correct you, be like,
that should be our undercover show. Just I'll go to
God.
plastic surgeon's
Dude,
office,
plastic surgeons would
and I'll
lose
go
their
in there and I'll
minds
be
if we
like,
did
can
that.
I have a double F? And if they say
So-
yes, I'm gonna be like, canceled.
that sounds super cool, but like we would have people like with pitchforks outside the studio if we started doing that. And as entertaining as that might be,
Even more reason to do it now.
I maybe we'll
It'll be
put-
like punked.
we'll
We'll
put
just
a-
get somebody that looks like Ashton. You could dress up like Ashton Kutcher.
Oh my God. The show is spiraling out of control. I like it. I'm not saying no. I'm not saying no, Sarah, but let's put a pin in that one and we'll
Okay.
circle back.
Circle back.
Yeah,
I like
circle
it.
back.
I like it.
All right, so yeah, large breast implants. Not a great idea. Once again, make sure you find a doctor who's going to talk to you and give you all the ins and outs. So, okay, moving on. So this is actually something I know a lot about. I know I've mentioned this a few times. One, plastic surgeons are kind of the end-all be-all of wound care. Also, I've been director of huge wound care programs for I think going on 12 years now. The last 6 or 7 years I've been at Horizon Medical Center, which I'm very, very proud of. It's arguably the best wound care center in the entire Metroplex. I honestly believe that. We just have like such a great wound care program. So I see lots of wounds, and every once in a while we'll do a case. I think last week we did, or 2 weeks ago we did the sternal wound, and we did a dog bite. So I want to talk about hospital-acquired wounds. That's actually my center. That's Horizon Medical Center up in the North Metroplex. Great little facility, LTAC, inpatient, outpatient, great place.
Nice.
Yep. So I want to talk about hospital-acquired wounds, and this is not just me yammering about wounds to hear myself talk. Like there is like my daughter uses that yammering. She loves that word. There is a purpose for this, because I feel like if patients are educated about what kind of wounds that they, or more likely their family member, like an older family member, could get, and they know the risk factors, that they could potentially prevent a wound from happening. And there are definitely downsides to people getting these wounds. So this is going to blow your mind. The estimated cost to healthcare. Okay, I'm going to ask you guys. I never quiz you guys anymore. I don't want to put you on the spot. No one's going to know this, but I'm just going to have you guys throw out a number for how much money does it cost the United States healthcare systems for wounds acquired in a facility, whether it be a hospital, LTAC, nursing home, in dollars every year. Who wants to go first?
I'll go
Travis.
first.
Okay, Travis. Yeah, throw me a number out there.
So like a yearly number?
A yearly number. And this is the extra cost that's added to our healthcare system every year because of the wounds that we're going to talk about.
I'll say 10 million.
10 million.
That's a big number.
It is a big number.
I don't even know. Like
Shooting in the dark.
10.1 million.
Try 30 billion with a B. 30
Gross.
billion dollars. Okay, to put that number in perspective, the healthcare expenditure in the United States every year is around $4 trillion. That means that these wounds equate to between 0.5 and 1% of the total expenditure of healthcare in the United States. Now I know 1% is not a big number, but think about how much goes into healthcare. Doctors' salaries, nurses' salaries, hospitals, drugs, surgeries, clinics, nursing homes. I mean, everything, all of that, and this is like about a little less than 1% of it that these wounds. So it is a big problem. I mean, this is not a joke.
Yeah, now I want to know which ones they are so I can
Cool,
make
I'm glad you're excited. So
make
good.
sure we don't get none of that.
Yeah, you don't want to get these. So as I said, the reason I'm doing this is because I want to educate people what they are to potentially prevent them. And I say this because these wounds can develop very quickly in the hospital. And once they develop, they can be extremely hard to get rid of. I have patients in my clinic. I have a huge wound clinic. I mean, I see, on average, I have 30 to 50 patients with wounds that I'm seeing. I don't see each one every week, but I see tons of patients with wounds. And some of them, the more difficult ones, I've had patients that have had wounds for a year, that they didn't want to have surgery, because I can always fall back on surgery. But for some patients, either surgery is not an option, maybe they're too sick, or they just don't want to have it. Some of these wounds can take a year to heal. So I want to go through what they are. And have you ever heard that the saying, an ounce of prevention is worth a pound of cure?
Yeah.
That goes triple for these hospital wounds, triple. Okay, so I want to go through the different types first. I'm going to list them out, and then I'm going to go through each one in detail. All right, I'm putting you guys on the spot. Can you guys name, there's a list here, one type of wound someone might get in the hospital?
Those like bed sores.
Bam, Sarah nailed it. Sorry, Travis, she took the easy answer.
It's okay. It's all right. She knocked it out of the park. I'm proud of you.
She knocked it out of the park. What do you think? Can you name one?
That you get in the hospital?
Anything.
I have no clue.
All right, it's cool. It doesn't matter. I just wondered if you guys, does the average person...
What about like bruises? Like bruises
Yes,
from...
trauma, right?
Yeah, right, all right. Bruises.
There you go, trauma. That's another one. Okay. Excellent. So you guys are all on top of this. Okay, so the different types of wounds, decubitus or pressure ulcers, so that's a bed sore. So decubitus ulcers, pressure ulcers, and bed sores are all the same thing.
Okay.
The doctor word's decubitus, pressure sore is kind of the description, bed sore is like the generic term.
Okay.
Surgical site infections, so someone has surgery and they
Right.
get an infection and that makes a wound. Edema wounds, so I'm going to break down what that means, but these are wounds related to having a lot of swelling. IV infiltration wounds, so when people have an IV that goes bad. Non-surgical infections, okay, so when you have an infection that gets so bad that creates a wound. Remember we talked about necrotizing fasciitis?
Yes.
So that'd be a non-surgical infection wound. That's actually some of the worst wounds you can see. Travis hit it, trauma, that's another one. And then lastly would be wounds from medical devices. All right, let's talk about the risk factors, okay? So I know you guys probably hate me. Can you guys name one risk factor for why you might get a wound in the hospital? I know you're not medical, I'm just,
A risk factor?
yeah, like,
Procedure issues.
bam, you had a procedure. There you go. That's a good one. You had a procedure, right? If you have surgery, you have an incision, then you could get a wound.
Yeah.
Oh, that's good. Travis, you want to stab in the dark?
I have no clue.
Okay, all right, very good.
I'm gonna bow out.
It's okay, man. I know I'm asking you guys medical topics. It's just always fun to see, I mean, you guys are smart. I feel like you guys know more about medicine than the average cat on the street. Like,
Absolutely.
you guys are good.
Sarah knocks like a lot of the questions out of the park.
Dude, I'll be sitting here and I'll be like, she'll just say something like, damn, Sarah, good job.
I have no
I feel like
clue.
she's absorbing all this information. It's like, it's
Absolutely.
osmosis. Okay, so risk factors. Immobility, right? So say you're
The
in
bed sores.
Right, bed sores, right. So you're in a trauma, or maybe you've had a heart attack and you're in the ICU, and maybe you're on a breathing machine and they're giving you medications, you're not moving. Immobility. Next, chronic medical conditions. We always talk about diabetes when we talk about risks. Diabetics are much more prone to get wounds, as are people that have things like, blood vessel issues where their blood flow is not as good.
Right.
Older patients, as you get older, your skin gets more fragile, your tissues get more fragile. It's much easier for you to develop wounds. Malnutrition, right? People who are malnourished, much more prone to wounds. Smoking, smoking's not good for you. By the way,
That's why they can't advertise.
that's why they can't advertise. Obesity, people that are heavier, more prone to wounds. Immunosuppression, so that's somebody that might be on certain drugs that are suppressing their immune system.
Okay.
Certain medications, things like steroids, which, that falls into immune suppression. Surgical procedures, like you said. Incontinence is huge. If people are incontinent, much more prone to wounds. I'm going to talk about that in a minute. And the reason that, it's so important, number one, these wounds are hard to get rid of, but two, it's been shown clearly that when patients get wounds in hospitals, it increases morbidity. So morbidity is just a word that doctors throw around, which means bad things, like, getting back to normal life or pain or whatever, and then mortality, meaning death. So these are reasons why you would definitely want to prevent a loved one from having one of these. Okay, so I'm going to talk most about two things because they're the big ones. So you said it, Sarah, bed sores, also called decubitus wounds. So we said that all wounds in the United States cost us $30 billion with a B. Decubitus wounds accounts for 25 billion of that. So it is far and away the biggest type of wound that people get in the hospital. There are 4 really common areas that people get these wounds. Sacrum, which is the area kind of in between your buttocks muscles.
Yeah.
All right. Ischium, which is what we sit on. It's called the ischial bone is the bone that we sit on. Of course, there's fat tissue and muscle underneath it. The hips is the other one, and the heels. And also, and this is kind of getting kind of a deeper dive into the pathophysiology about this. Those pressure points do come along with certain positions. So for example, if I was to sit in this chair for a year, which I wouldn't do, I would get wounds on my ischiums because that's where the pressure is, but I wouldn't get it on my sacrum because there's no pressure on my sacrum. When the sacrum gets pressure is when you're lying flat in bed on your back.
Yeah.
Then you get pressure on your heels and you get pressure on your sacrum. When you're lying on your side, you get pressure on your hips. Why am I telling you this? Well, if you have a patient or a family member in the hospital and they're staying in one position, then they're going to be at risk for getting wounds in those locations.
Yeah.
And it's common sense, right? When you're laying flat on your back, like you're on your buttocks, which is your sacrum, and you're on your heels. The back of your head's kind of an honorable mention. Sometimes people will get wounds on the back there. So what are the risks of decubitus wounds specifically? Pressure's number one. What we do for our patients, especially when they're immobile, is we Are we good? Are we good, Travis?
We are.
Okay, just checking. The monitor went dead. We make sure that we rotate patients because we don't want them to have pressure in the same location for long periods of time, because that's what causes these wounds to develop. And so you might say, okay, what is about the pressure? Well, when you have pressure in one location for long periods of time, it actually inhibits the blood flow. And so what it does, it basically strangulates the life out of those tissues, and the tissues die, and then the wounds develop. Immobility is the big one too. Pressure, immobility, incontinence. Man, this is such a huge one. When patients are in the ICU, oftentimes, they'll have a catheter in, but the stool, poop, they poop on themselves. And if it's not caught quickly, that stool sitting on the skin can cause a wound so fast. And this is one where patients' families can really be helpful, because if they realize that their family member who might be sick has an issue with incontinence, then they need to alert somebody right away, because that's one of the things that can cause these wounds to develop. The extremes in weight's a big one. So when people are really heavy, like obese, then they have added pressure. But the flip side is if you're really skinny, then your bones are pointier. And so you'll see malnourished patients get wounds really quickly because they're thin, they don't have that cushion, and so that pressure point causes a wound. Advanced age, also older patients, patients who are ill, smokers, and then also the surface. I use that one, like for example, if somebody was maybe maybe a patient that's in a nursing home and they're sitting in a chair that's maybe like a rocking chair that's hard wood. Bad idea.
Right.
You want to have a nice cushion, and especially people who are at risk, you want to have specialty cushions for them to sit on, because these wounds can develop very quickly. As far as treatment, I'm not going to do a dive into the treatment of these. That would be a separate talk. Treatment of these is very multifaceted. There's wound care, surgery, all kinds of things you could do. So after decubitus wounds, the biggest next wound that people can develop is surgical infections.
Right.
So 2 to 5% of surgeries result in infection. Now, you have to take that number with a grain of salt, because it really depends on the type of surgery you're doing. For the surgeries I do, young, healthy people doing elective superficial surgeries, infection rates should be way less than 1%. And it is. Like for example, breast augmentation, literally in 14 years of doing these, I've had one infection. I mean, this is like hundreds of cases. But it's because I'm doing a simpler surgery. I mean, it's artistic, but otherwise rather simple on a healthy patient. Surgeries that carry more risk are things like intra-abdominal surgery, GYN surgery, where these are considered more contaminated cases, orthopedic surgeries, and then trauma.
Right.
When you calculate those have a higher rate. So the average falls into
surgeries.
What's that?
I've had 2 of those surgeries.
GYN.
Or is GYN that's just what is that?
Like a C-section.
Okay, yes. I've had a C-section and I broke my arm when I was a kid.
Okay, yeah, orthopedic. Did you heal okay?
Yeah, I had like pins in my arms and everything.
Yeah, I'll tell you what really common in intra-hospital wound is C-section infections, because they're considered dirty cases, because of the, opening the uterus, and, there might be, they call it meconium when the baby, has a bowel movement in the placenta, and so that gets in the wound. So those are considered dirty cases. So yeah, that's a high one. But the cost of surgical infections, $3 to $4 billion. So right there, you see where most of the money comes from with wounds is either decubitus wounds or bed sores, and then surgical infections. So for every surgical infection, it increases a hospital stay about 10 days.
Okay.
That's a lot, and it increases the cost of stay by about $20,000.
Yeah.
That's a big number. It does increase. Huh?
So it's serious.
Yeah, it's serious stuff. It increases the morbidity and the mortality. So what are your risk factors for getting wound infections? Well, we talked about the type of surgery is important. If you have a loved one that's in a trauma surgery, orthopedic surgery, abdominal surgery, GYN, those are ones a little bit more concerning. If your patient has the illnesses like diabetes, if they're obese, that's a big one. The thicker that tissue is that you have to cut through to get into, like, say, the intra-abdominal compartment, the more likely they are to get an infection. If they're smokers, the site of the location, so like feet are a place or lower extremities don't heal near as well as upper body. And then compromised patients. And so, as somebody who, maybe has gone through surgery and you have an incision and you want to know if you're at risk for infection, those would be your risk factors. But the other thing to know is timing. Oftentimes when I was doing general surgery, we'd get a call from someone on the floor, like a nurse or a med student. They say, hey, patient's got a fever. They're one day out from surgery. Do they have an infection in their wound? And the answer would be no, because the average time frame for when people get infections is about 4 to 7 days. So you can kind of time that. Now you can get them later. Every once in a while you'll see somebody get an infection a week, 2 weeks later, but it's not that common. Symptoms of that: new pain at the incision site, redness around the incision site, and drainage.
Okay.
Any of those things pop up, you need to let somebody know. And the reason I say that is there are a lot of times the first person to know that they have an infection is either a patient or a family member. And if they don't call their doctor, then that can get out of hand and you can get like a worse problem.
Yeah.
It's always good to catch these things early, whether it be the bread sores or the surgical site infections. So I'm just going to kind of gloss over the other ones because this is kind of getting into the weeds of the rare stuff. Anytime people have a lot of edema, so edema is when you're swollen.
Okay.
Edema is doctor word for swelling. So when people get really edematous, like say the lower extremities, because maybe they have issues with their veins, or maybe they're more sick and they start to gain fluid, that does put them at risk for wounds. The bottom line on those is just being aware of it and getting those extremities elevated to help get the fluid out and getting some compression on it. And believe me, I walk into patients' rooms all the time and they have this edema and like no one's doing anything. And I'm not, slighting my medical colleagues, but there's a lot of stuff going on. Not everyone thinks about that thing, but as a patient or a family member, if you know that a lot of swelling can cause wounds, then you can be proactive in the care. Talk to the physician, talk to the nurse, say, hey, what are we doing about this? Non-surgical infections, remember we talked about necrotizing fasciitis, which is the one where the tissue dies. Now that's an extreme case of a surgical infection causing a wound, but even smaller wounds that are even lesser infections can cause wounds. So once again, if you think you have an infection, which same symptoms are the same for an incision versus just a regular infection, go to your doctor, don't let it get out of hand. Trauma, that's another one. Like elderly patients in hospitals are at risk for falls. I get consults all the time for a patient got up to go to the bathroom, fell, hit their head, now they got a wound on their head.
Gosh.
Yeah, it happens pretty commonly, because why? Well, people are tethered to all these IVs, they might be tethered to other machines, they're...
And then whenever you stand up, like after you've been laying down for a while.
Get lightheaded. Yeah, totally.
And you kind of forget like I remember whenever after I had my C-section, I got up and I was like,
right. Yeah, you're unsteady on your feet. Yeah, totally.
For sure.
So falls can definitely happen in that instance. The last one I want to bring up is medical devices. So the classic one that I think about when I hear about this is either a nasal cannula that's giving oxygen that's too tight, or a mask that's giving oxygen that's too tight. Pressure on skin over even a short amount of time, if it's significant, can cause wounds. And I'll get consults for tubes that cause wounds, nasal cannulas, masks, all of that. So if you have a family member that's in the hospital and they have something on them and it's really tight, maybe ask, hey, is that too tight? Do we need to loosen it?
Yeah.
So that's about it as far as wounds go. I mean,
it's a lot of information.
I know. Is it too much? Did I drown you in information?
No, I was just like.
Well, I mean, as I said, I always try to think, okay, why are we talking about this? I mean, maybe people just want to know about it. And some people are interested in wounds, but from my standpoint, it's like, okay, if I can educate somebody on like what kind of wounds are out there and what the risk factors are, maybe when their mom or granddad or someone's in the hospital, they'll have in the back of their mind, hey, my granddad hasn't been moving. Is he at risk for getting a bed sore? That'd be a really smart thing to say.
Yeah.
And maybe you could prevent something like that from happening.
Yeah.
Yeah. Education.
Yeah, that's facts.
Facts. Speaking of facts, Sarah,
it's my turn.
Are you going to give us some facts about this protein diet? I'm super excited about this because I love protein. It's probably my favorite food group.
No, you don't.
No, I do. I love cooking steaks. Like steaks, chicken.
Okay.
Oh, that's my favorite thing to cook is protein.
Okay.
Are you talking about different proteins?
I'm just talking about you eating enough protein in general.
I don't eat enough.
Yeah.
I know that. I get crazy about my diet.
What?
I get crazy about my diets. Doctor, heal thyself.
Okay.
All right, teach me, educate me. I'm ready.
Okay, I only have one picture. So
One
Travis,
picture.
Yeah.
But wait, hold on. Do we want to show it now, or is there like a moment we should show it?
No, it's just like a little
thought there were
title
two.
slide. There is.
I thought there were two. I could be
It's
wrong.
Oh
that
wait.
one.
Oh, Travis. I think I forgot to show one in the
Gotcha.
last segment.
Okay,
My bad.
gotcha.
Don't show that now. We're talking about food. Don't show. There was a wound, so we don't want to show that.
No
We
problem.
don't want to show that. Yeah, I forgot about that.
Yeah.
All right.
So I'm just going to talk to you about like what protein is and how it can help your life and how much you should eat.
Okay.
And that's pretty
Now,
much
is this
it.
eat just to stay healthy, or is this eat for like?
I'm going to tell you what to
okay.
eat to, like what FDA is recommended.
Okay.
and then how to gain muscle.
I'm ready.
etc.
We are listening and taking notes now.
I'm ready.
Okay, so what is protein? I
So-
know you know what it is.
I do.
So protein, structural amino acid. Everybody has them, and our body actually needs animal foods and things to make them.
So do you think it's risky for like vegans? Did you see any data on that about?
Yes.
So there are some risks associated with that.
What do you mean, like risks?
Well,
of
because
not
they're getting
it?
no, like,
Well, it's
you're
hard.
getting-
It's harder for
yeah,
them,
getting
but
no
they
animal
but they
protein.
definitely can
Yeah.
because of tofu and
Oh,
vegetables
right.
that have high
They can get
protein.
around it. Yeah.
Yeah,
I could never be vegan. I love
it's hard.
meat too much.
It's very. You have to be very dedicated. I
Yeah.
applaud them because I
I could never do it.
like beef. Okay.
I do too. Yeah.
So how does protein affect weight loss?
So, are you asking or?
I mean, you could probably answer that if you want.
Well, you gain calories from protein that's better than certain type of carbohydrates and certainly fats.
Yeah.
Yeah. Right?
Yeah. So
Yes.
it boosts your metabolic rate and causes a spontaneous reduction in calorie intake. So it just
Okay.
takes longer to digest, really.
So it's a better caloric source for
Yes.
maintaining weight. Yeah, I've always heard that. I mean,
Yes,
the
yes.
Atkins diet's the big one, right?
Yeah.
Yeah.
But that one's like very heavy on red meat, which
Nice.
they've kind
That's right up my alley.
They've kind of distanced themselves from that because red
Oh.
meat causes heart disease.
Yeah.
It increases it an excessive amount.
I'm not sure I believe that. I'm just kidding.
Okay, so how much protein should you be eating?
So I actually used to know this from when I used to work out a lot. I think you want to have, if you're not active, isn't it 40 to 60 grams a day?
Yeah, so they like minimum amount FDA recommends like
like
average
half a gram
person is
per
like 50
kilo?
grams.
50 is minimum.
Yeah.
Okay.
But like women, of course, it says like 35 minimum for
Do you
women.
count your protein? I know you work out a ton. Do you count your protein?
Yeah, I try to.
Yeah.
So most studies suggest 0.7 to 1 gram per pound of lean mass.
Isn't that per kilo or is it per pound?
It can be 1.6 to 2 grams per kilogram.
Oh, okay. So that's higher than I thought. Okay.
Yeah.
All right.
But
and,
yeah.
and that's for maintenance or for muscle growth?
That's if you want to gain or maintain your
right.
muscle. Yeah.
Gain. Okay.
And
'cause
most people that want to have
Yeah.
a high protein diet want to lose weight or
Right.
gain muscle.
gain muscle. Because I
Yeah.
remember when I used to work out a lot, I used to try to do 2 grams per kilo. So I was trying to do like 150 grams per day, which sounds like a lot.
My minimum's 100 grams.
Yeah, and I'm a little bit lighter than you. Or no, a little bit heavier. Sorry.
I was like,
Wrong way.
where?
Sorry, I
What?
didn't mean that. I'm sure I outweigh you by a fair amount.
I don't know. I weigh 125. Most people don't think I do. Most people think
So
I'm lighter than that.
I told you I've been losing weight because
Yeah.
I just had been out of shape. So I was like around 160 and I lost
Yeah.
about 10. So I'm about 150, but like I'm lean now.
Yeah.
Now I'm about ready to start gaining muscle.
Yeah, you need to increase your protein.
I know. I need to put on some muscle.
Okay.
Sorry, Sarah. I didn't mean to derail you. Keep going. You're doing
So most adults that have minimal activity, physical activity, you can get away with 0.8 grams
Okay.
per kilo.
great. Per kilo. You
Yeah.
can get away with it.
Yeah.
Okay.
If you exercise with weights and body weights, you can eat 1.2 to 1.7 grams per kilo.
Right. That's when I
Yeah.
was, that's what I would shoot for.
Yeah. So yeah, I eat between minimum 100, max 125.
Now, does it matter the type of protein, or are you going to come to that?
Yes.
You're going to come to it, or it
I'm
doesn't
going to
matter?
talk to you about it. Yeah.
Okay, good.
And then athletes like extreme, like
Right.
a professional,
Like
they can
triathletes
do
or-
like 3.5
Wow, that's
grams
crazy.
per kilogram.
Yeah, I mean, that makes sense. Like those triathlon
Because they're doing
people.
like morning
yeah.
workout, afternoon, maybe even midday. They're like constantly.
I wish I had
working
time to
out.
work out that much.
Well, I mean, that's their job though.
Yeah, that's true.
So
That'd
they
be
make time. So who needs to increase their protein? You? Do you need to increase
I do
your
need to
protein?
increase my protein for sure.
Okay, so pretty much everyone and anyone can increase their protein in
Okay.
a healthy amount. Obviously, it's really good for people that are physically active, of course. Pregnant, you should be
Mm-hmm. Oh, right.
increasing your protein.
That's good.
Breastfeeding as well. So they say the FDA recommends to increase it to about 70 grams.
Trying to heal wounds.
Yeah.
That's a big one. Like if you're in the hospital and
Injuries.
you're infirmed, you want to
Yeah.
increase your protein because it helps you
Yeah.
heal.
Yep.
Bam.
Interesting.
Older adults need more protein. And they say that FDA recommends to increase that by 50% too. But yeah,
Yes,
recovering
older.
from injuries and all of that.
Yeah, because that was really big when I used to do trauma surgery. Like we were really, really big on their nutrition, and
Yeah.
like it was kind of a beatdown. But this is what we had to do when we were residents. We had to calculate this huge thing. It was all the stressors they had to get a caloric expenditure per day, and then we would try to go above that. And it was this big sheet, and I had to like do math as like a first and second year general surgery resident for every single patient in the ICU and write all this stuff out.
Yeah, but it's
It was
like
brutal.
what's almost everything in our body made out of? Amino acids. And
Yes.
you need
Right.
amino acids.
Yeah, you need it.
Especially if you're like recovering from
Oh, sure.
something.
Yeah,
you
trying to
need
heal
to
something.
rebuild something.
Definitely.
You need it. You have to have it. So what are some negative effects of protein, you might ask?
It can be hard on your kidneys and liver.
I actually, so the article I was reading is
digging
from
deep there.
healthline.com. So it was like made by nutritionists and things
Yeah.
like that. And they were talking about how there's no real, like, I'm sure there are articles, but no articles that have like dramatic evidence that it can cause heart disease.
Oh, so
I mean, not
even-
heart disease, kidneys.
So I would say that's true, but I know for a fact that certain medical conditions
Yeah, you
affect
need-
your
yeah.
ability to break it down.
Yeah.
And so then you have to like
Yeah, you
do
have
a
to
lower
consult
protein
your diet,
Yeah.
your doctor and stuff like
Yeah.
that, for sure.
But the average person, that doesn't matter. Yeah. The
Yeah.
average person.
So pretty much with anything, like I'm a big fan of everything in moderation and
Sure.
balance. So again, everybody knows you're not supposed to eat excessive amounts of red meat.
Right.
So, or in high fat protein because of your risk for heart disease.
Yes.
And then also when you're like the Atkins diet, which they've kind of ventured away from it, is
Because that was the red meat one, right?
yeah. So it used to be like all meat, like you don't eat vegetables, you don't
All
eat
meat
fruit.
all the time.
Yeah.
Triple patty burger.
Yeah.
Come on.
Yeah, like you have a steak and then a side of beef jerky. It's like that's what it was.
Nice.
So it's like no, that's not the way anymore. Obviously, you're supposed to have protein, vegetables, fruit.
Right. You got to mix it up.
Yeah. But yeah, those are some of the negative effects that can happen. But like with everything, if you're like doing like a new diet, definitely talk to your doctor about anything
Yeah, absolutely.
especially if you have some pre-existing
Yeah, right.
existing
With certain
condition.
medical conditions, you want to be a little careful about taking
Yeah.
huge amounts of protein.
I try to eat protein, but I hate steak.
You hate steak?
I know it. I know
What?
it's so weird. It's so
That's
weird.
so crazy.
Well,
I do not like steak.
what's your protein of choice then? Chicken?
Yeah, it would be chicken.
I
yeah.
do like chicken.
Yeah, that's what I was about to say.
I just
So-
can't believe you don't like steak.
I just do not like it.
Man.
And if I do,
That's
get
like
it,
saying you don't like money. I mean, come on.
Such a man thing. You don't like red meat, boy?
It's not about that. It's just so awesome. It's like I just don't like money. I just don't like
I
it.
don't like money. I love money. Well, not love it. I like money. But yeah, I don't know. Steak just don't do it for me.
Really?
Yeah,
Okay.
it just always tastes kind of strange.
Wow.
I mean,
okay.
it's healthier for you to eat chicken anyways, and
Is it?
fish.
Yeah, I mean,
Yeah.
I've always heard that. Yeah.
It is.
Yeah,
Chicken,
I do like
pork,
white
fish.
meat, breast chicken.
Yeah.
Yes, for sure.
Yeah.
Pork, no.
Steak's my favorite
It's
though.
high
I
fat-
love.
that's
I
a
love
high
fish.
fat protein.
Is fish really like good for protein, like high in protein?
Oh
certain
yeah.
For sure.
Oh yeah.
Oh, okay,
for
really?
sure.
For sure,
Like
for
tuna. I used to eat a lot of when I was like really working out. I eat tons of tuna.
Salmon.
Yeah,
Good.
salmon's good.
Fish? Okay.
I love salmon. But that's what we're talking about. So how to increase your protein, you might be wondering, like in your daily life.
Absolutely.
I'm wondering.
Eating protein for your first, like, before you start eating any of your like little sides, try to start eating like that piece of chicken first or that
Okay.
steak first before you touch the taters. And
Is
the
that because
stuff.
of the
That's
digestion?
Um,
we know that taters are bad
So
carbs.
I'm
We
gonna,
talked about that.
yeah. So high protein.
We're getting so smart around here.
Thanks.
We're like three geniuses.
Thanks.
So eating protein first at meals can help you feel full and keep your blood
Oh,
sugar
right.
and insulin levels from rising too high. So
Okay.
high protein intake decreases levels of ghrelin, the hormone, the hunger hormone.
Oh,
Is
okay.
that how you say it?
I'm not
Ghrelin?
familiar with that one.
Ghrelin. So
That
GHRE.
sounds vaguely familiar.
So and then it increases your metabolic rate after eating and stuff.
Okay.
So yeah. So a second thing is choose better snacks. So instead of eating like a potato chips or whatever.
Eat beef
those
jerky?
things. You can totally eat beef jerky for sure.
I like turkey jerky.
Yeah.
I need to
choose-
write this down.
Dude, if you don't like beef jerky,
I'll
try
send
the
it to
turkey
you.
jerky.
Please.
So
It's good
choose
stuff.
cheese
Turkey jerky,
for
Oh,
a filling snack.
I love cheese.
Yeah. Have it with some cheese. I mean, just have it with some more cheese. Have it with like fruit and some whole grain crackers.
Dude, I love-
That's like your own personal little charcuterie
Dude,
board.
can I derail this for 1 second
Yeah.
to tell you a story? My wife got me the best gift ever. She got me a membership to the
it a
Cheese
cheese
and
club?
Fruit of the Month Club. So once a month
love
we get this
cheese.
thing, and it's like it's from Harry and David, and it's like some type of fruit and then a cheese that goes with it.
That's nice.
And so she told her friends at work that she got that for me, and they're like, "Why would you get that for him?" And like she's like, "No, he's gonna love this."
I love
She's
cheese.
so right, man. I love cheese and fruit.
Me too.
Sorry, didn't mean to derail your story.
I love it.
It's so good. Okay, and then replacing cereal with eggs.
Yes.
So that's
Breakfast
like a
tacos,
simple
right?
one. Yeah. So like, if you're a busy person, I like to cook pre-cooked hard-boiled eggs.
Oh, I can't do hard boiled.
But those are easy. That's an easy way
It
to
is
add
easy
protein in
snack,
the morning.
but-
If you're not the one type of person that wants to like cook in the
Yeah.
morning, and then also if you have some whole grain oats in the morning as well.
Oats are good. That's a good
Yeah.
carbohydrate. We know that from
and it's good.
a couple
it's
episodes ago.
a complex
Right
carb. It's good for you, and
Yes.
it also has some protein in it. And then nuts. So
Nuts are good.
almonds are the best ones for you to eat. They're the
I love
highest
nuts.
in
Cashews,
protein, about 6 grams of protein an ounce. So if you can sprinkle almonds like on cottage cheese, yogurt, salads,
Yeah.
all of that kind of stuff, that increases your protein a good amount. And then speaking of yogurt, Greek yogurt contains twice as much protein as regular yogurt. So I eat
Okay.
Greek yogurt all the time. It has like 15 grams. That's pretty good.
Wow.
Yeah.
I do like how they substitute Greek yogurt. A lot of people substitute Greek yogurt with for what is it? Like not Miracle Whip. Like
Mayonnaise. Mayonnaise?
Nah, it's the other stuff you put on
Ranch.
like nachos. Sour cream.
Oh, sour cream.
yeah.
Sour cream. Yeah,
Yeah.
you was close though.
I was
Yeah.
trying hard,
He
man.
was. He was
The
trying to get-
regular,
I got you,
the
Travis.
regular Greek yogurt.
I give you a bunch
for
of wrong
sure.
answers.
We got there. We got there.
And then this is my favorite one:
Okay.
a protein shake.
Oh, yeah. I
Yeah.
actually used to do a lot of protein shakes when I was really working
That's an
out.
easy way
Yeah,
to
it's
add
easy
protein.
protein.
So my go-to protein recipe: 1 scoop of whey protein, a cup of frozen fruit. I always go for frozen strawberries, and then a cup of ice. And then you just blend
Blend
it
it
up.
up. It sounds
drink
great.
And then if you're more of a person that needs some extra sweet in there, add almond
Honey.
milk or honey
Yeah.
is a good one. But if you add almond milk, it makes it creamier and
Oh.
then has that sweeter taste to it.
My wife makes those smoothies pretty commonly. I don't know what she's putting in them, to
Yeah,
be
I
honest.
don't like
she's
to
probably
put, like,
putting vodka in
I've
them for all I
put-
know.
Not mine.
I don't like putting all that weird stuff in it, like spinach and
Oh,
stuff like
no.
that. I don't do
Dude,
that.
I do
don't
not
even
want
like
a
putting
spinach
I don't
shake.
even like putting peanut butter in it. But peanut butter is another good thing to add to your diet.
Yeah.
It's a
Doesn't
healthy
peanut
fat.
butter have? Oh, it's a.
and
I was
it's
about to say
protein.
it has a lot of fat, but it's healthy fat.
Yeah, but I mean, obviously you can't eat it in excess. But like when I was really watching what I was eating and I needed to have a certain amount of
Yeah.
fat, I would eat a spoon of just like a spoonful of peanut butter. Yeah, that was like a nice little treat after
Nice.
dinner or something sweet to eat. But then obviously your go-to high protein meat, I guess you could say, is beef, obviously, fish, poultry, eggs, legumes, and soy products if you're vegan and stuff like that.
Yeah.
So an example of, for chicken, 3 ounces of chicken is 23 grams of protein. And you
Nice.
said that you need to eat at least 20 to 25 grams of protein at each meal,
Right.
at least.
Right on.
And then for meat, beef, this is where you come in. So instead of getting a T-bone steak, which
You
is,
should get lean steak, is what you're gonna tell me.
yeah,
Sirloin.
instead of yes.
Yeah.
So 21 grams and T-bone steak, and then
disappointment on your
sirloin.
face.
Sirloin steak is 26 grams of protein, but listen to this: the
Okay.
calories are
I
extremely
know.
different.
I know.
calories.
I know.
So
Dude, I love the fattiest steak you can get. I love
Yeah,
like Wagyu.
but it's
Like I want
easier.
my steak to be like white.
yeah, it definitely tastes better.
Yeah, it does. It's not as good for you.
But yeah, there's so many other things you can. We've already talked about canned fish.
Oh yeah.
Tuna.
Canned chicken even is good.
Edamame.
I
is
love
good for you to
edamame.
eat.
So
Cottage
good.
cheese. I haven't really had cottage cheese yet, but I like yogurt.
I like cream cheese. Does that count?
Yeah, but you can't eat that. You can literally eat cottage cheese like yogurt. Like they sell it in
Gross.
little cups. My friend Cassie loves it, and you know how much? There's 23 grams of cottage cheese per cup.
23 grams protein.
Yes.
Per cup.
Yeah,
Yeah,
sorry.
got it. Yeah.
Mouthful. But yeah, those are like all the ways you can increase your protein, and it's
Yeah.
like
I need to do that. I don't need enough protein.
I think the biggest thing for me is usually whenever I'm getting like I want a snack or something, and I always want like a carb or something
Yeah.
like that. That's where it gets difficult.
I do like to snack on beef jerky and nuts too. I'll snack
Yeah.
on. I like my favorite's the deluxe mixed nuts, but it's so expensive, but they're so good.
Yeah.
Like the cashews.
Well, I
and-
can't eat almonds.
Oh, you can't. You're
They
allergic.
hurt my tummy.
Oh,
Yeah.
sorry.
But yeah, that's all
that in
for
mind.
proteins.
All right.
I like it.
I mean, it is good information because, a lot of people are struggling to like think about, okay, what am I going to eat? And so like substituting protein is only going to help you and
Yeah.
help you with your weight because as we know, like there's certain carbs for sure that add on weight.
Yeah. So
Yeah.
like when you're increasing protein, make sure that you're also like keeping in your calorie.
Right. You want to stay in your
Like,
calorie box.
if you increase your protein but don't
yeah.
manage that with your calorie, then you'll
You
gain
get in
weight.
trouble.
Yeah.
Well, and also too, the only thing I would add is that if you're going to do anything extreme, like go really heavy with protein, talk to your doctor and make sure that it's okay
Definitely.
for you. Yeah. So, but that was great, Sarah.
Yeah.
I loved it.
I like
Thank you. I always love
protein.
your segments. It's kind of fun for me. I can sit and listen to you and
Yeah, well,
just
I mean, it's
chime
like
in.
I've definitely noticed a difference whenever I started eating more protein,
Yeah.
especially at the gym. So
Excellent. All right. Well, I think that's all the time we have for this week, but we will be back next week talking about some new topics. Please leave us a comment, hit that like and subscribe button. It helps us so much, and we'll see you next week on Nip Talk.